everyone, my name is Vondechii and I'm the CEO and founder of Vondechii's Vault. Today, I wanted to delve into the importance of health literacy. So, let's begin. As we all know, health is an essential component of global civil society. As a public health graduate student, I've read many literature reviews and research articles that stem into global healthcare initiatives directed at overcoming barriers of health, globally improving health outcomes, and different books that stem into global healthcare initiatives directed at overcoming barriers of health, globally improving health outcomes, international systems that measure overall health via fundamental indicators of individual health, health literacy, health communication, international systems of health record keeping in international databases, innovative technologies and global efforts via short-term and long-term international health goals that aim to improve population health. And as we know, technology continues to accelerate the advancement of public health. The evaluation of these health improvements leads us to question the fundamental concepts of health communication and the transmission of health information. In one of the articles I was reading named Health Literacy, Communication for the Public Good, I was faced with a few questions such as, how can we expect population health to improve if the population we're dealing with is not literate in health? Also, how can we expect individuals to become autonomous with their health if individuals rely on a fragmented healthcare system that doesn't promote autonomous living? Also, how can we take our combat with population health onto a global scale when our healthcare system here in the US is a competing multi-payer system with different levels of complexities and municipal determinants of health? Also, even though this may seem basic, what is the true definition and meaning of health? How do we measure an individual's health competence and health literacy? Also, how can we measure an individual's health? Well, here in the US, the state level of government essentially has the most power to control municipal determinants of health via public institutions that make collective decisions. State policymakers and stakeholders should be aware of the serious impact health literacy has on health communication, with health illiteracy contributing to undesirable health outcomes, and bridge concept linking knowledge and practice health literacy before assembling resources and health policies that affect social, economic, and environmental determinants of public health. State departments, policymakers, and stakeholders need to adopt health literacy as a fundamental concept of public health and incorporate it as an ecological parameter of health promotion, from medical institutions of health to health communication via patient-provider interactions through effective communication. This can facilitate the process of staying healthy, getting better, and living with disease by linking medical terminology of primary, secondary, and tertiary prevention with determinants of health. For example, social, physical, and environmental, education, income, and risk factors. So this video highlights health literacy and health communication as an essential component of public health, from proximal interventions to distal determinants of health that ultimately stems into global civil society. So, what is health literacy? Health literacy, termed in 1974, was defined as health education meeting minimal standards for all school grade levels. However, recently, health literacy has been depicted as both a goal and an outcome, becoming the currency and capital needed to develop and sustain health. So, the development of health literacy using strategic communication via formulative research is also clarified as translating evidence-based medical discoveries into a healthier society. Strategic science-based communications can advance social norms that encompasses appropriate health promotion activities, policies, personal responsibilities, government roles and services, and finally, baseline health knowledge and skills. There was a quote in the article that was really intriguing, and it goes, "The communication should not be lost in the technology," which means getting the right message to the right people at the right time with the intended effect. In conclusion, to attain health literacy, policymakers and leaders outside of the health sector must be aware of the critical elements that contribute to health illiteracy. Framing such issues can mobilize forces from those those outside the traditional health policy to truly develop health, ultimately affecting the social, economic, and environmental determinants of health. Thank you so much for watching this video. If you would like to watch other witchy wellness videos or public health videos such as this one, please go to our website, which is www.vondechii.com. Thank you so much for watching. See you there. Bye.